My name is Jessica Gold-Boots. I am the Vice President of the Malden Education Association, and I am a Malden Public Schools educator. I wanted to talk today about some of my reasons for getting vaccinated for COVID-19 and why I think other Malden educators should also be vaccinated as soon as possible. So many of us live with or love someone who is immunocompromised. And when someone is immunocompromised, that means that their immune system does not always work the way it should. If they get sick, for example, with something like the common cold or the flu, they may need serious medical attention or even to go to the hospital. My husband is immunocompromised, and he actually is because of his service to our country. He served in the United States military, and he actually served 2 deployments, including one in Iraq. When he was in Iraq, he was actually a tank driver. He encountered an explosive, and he actually not only lost his leg, but they had to do major surgery on him, including taking away his spleen. And when you do not have your spleen, your body does not always produce the antibodies and all of the things you need to fight off an infection. So COVID-19 has been very scary for us because even though we are both on the younger side of things and relatively healthy, he is immunocompromised. People can be immunocompromised for many different reasons, maybe based on age, maybe based off of a disability, maybe based off of lots of different reasons. But it's so important for those of us who are able to get vaccinated to do so, to protect people who can't or who are more susceptible to COVID-19. So that's part of the reason why I think it's so important. Another reason why I think it's really important for educators and all school staff to be vaccinated is that many of us live in intergenerational or multi-generational households, students and staff alike. What that means is that many folks don't just live in that traditional nuclear family setting anymore. Many of us live with older relatives, and as we have unfortunately seen, many of our older relatives or many of our more vulnerable relatives are very susceptible to getting sick with COVID-19. The more of us who get out there and get vaccinated is going to be incredibly important for stopping the spread of COVID-19. If you have any concerns or doubts about the COVID-19 vaccine, the best person to consult is your primary care provider. You can't just take my word for it that it works, right? You need to talk with your medical provider, your trusted doctor, or your physician's assistant, and really get their opinion on whether or not the vaccine is right for you. But I do know for the vast majority of people, the COVID-19 vaccine is safe to take, and we should as soon as possible. I think it's just going to be such an amazing opportunity to protect our loved ones, our students, our colleagues, and their families. Thank you so much.